Webinar Wednesday. Thank you so much for signing on. And we have Neil today talking about telehealth, why telehealth is good for everyone and here to stay. I'll give you a little bit about a snippet about Neil. His expertise in healthcare and insurance and risk management fuels his passion for in and out of field consulting with employers and health plan administrators across the United States. Neil is a partner at Benefits by Design Incorporated, and he also founded Alliant Financial Services Incorporated to address the issue of employers being overburdened by skyrocketing healthcare costs and lack of transparency in the ongoing healthcare debate. Neil is an accomplished healthcare professional with an extensive background in leading edge strategic healthcare initiatives against predatory pricing. He has provided guidance for business throughout multiple industries for the past 26 years. He thrives on finding creative solutions to complicated problems. All right, and with that, I will hand it over to you, Neil, and thank you so much for doing this for us today.
Hey, thank you for having us, and thank you for the opening there. As some of you know, I'm the program director for the URG healthcare program, and today I have Pete Cohen, who's the director of Telehealth, joining us, and we'll be discussing a couple programs that are relevant to everything that's going on right now, and something that you might want to consider and how it can benefit you. With the new world we live in, I kind of decided to shift the overall program message that we were going to have at the conference to a couple topics, and in the URG blast, you were seeing that we did, some different offerings with solutions that, range from funded captives and non-funded captives, along with some level funding and self-insurance programs. And I think our message is going to be a lot more relevant with, the big box carriers, and whether you're ACA or just with some kind of level funding with, like an Aetna or Blue Cross or United Healthcare. As they reassess the impact of this whole COVID-19. We'll be putting more out on that later, but the solutions we offer aren't from me just, cooking these up, I guess, in my house with the COVID, but, we're a partner firm with a group called NFP, which is, it's a Benefit Partners is a division of, and so, just to give you a little bit of an overview, there's 250 offices and about 5,000 benefit professionals, and what that really means is some volume in terms of buying power. The whole program here. I'm kind of moving my slides here, so let's see if we can begin. My screen isn't changing, Amanda.
Okay, try hitting the next button. Have you tried the arrow button?
It shows
down below. There you go.
Okay. Anyway, starting to get a little rattled there, but anyway. So again, we have a multiple group of people that are working with this, and we work in a number of different segments, and we cover health strategy, retirement strategies, executive benefits, and property and casualty. So I just wanted to point that out. I think it gives you a little more feeling that we're looking at this across the country, so we vet these processes, and that's how it could probably make sense a little more for people to embrace something if it's being done around the country by many. With that, I'm going to turn this over to Pete, and he and I can kind of talk about, again, two different things that we're going to visit about today is Healthiest You, and there's a couple different flavors of that we can go into, but Teladoc has come up with a unique value proposition that it seems like it's going to be really relevant to your industry and what it does, and again, the whole environment of what's going on today. And Pete and I have worked up a presentation, and we'll try to get through it. And if there's questions, I guess you'll see those on your end, Amanda.
Yep, I will let you know if you have any going forward. And if you guys have any questions, just drop them down at the Q&A in the chat box down below, and we'll get to those as they come in.
Perfect. Pete's been with Teladoc, and they just rolled out this new program that's called Healthiest You, and it's basically a telemedicine on steroids is how I would call it. It's more than just calling a general practice doctor. It's got a lot more layers to it, and I think with the buying power that URG has and the things that we can offer might be something you want to consider. I think that one thing I'd like to point out too is that, when you have a telemedicine baked into your current program with I'll call a big box carrier like the Blue Cross, the Aetna, the UHC, a lot of times you have a copay that the member pays, and what we're offering is a zero copay model, and those claims that would result from the back end under a normal big box carrier don't go into your loss ratio. So when you have this type of separate program, the back end claim isn't going against your loss history, and this is also compliant with a HSA plan where you can still have that zero copay. Pete, do you want to kind of start here? Do you see my screen?
Yeah, absolutely. And thank you all for joining. I want to kind of start today just talking a little bit about telehealth in general. If you've paid attention to the news in the last month, our industry has gotten about a month-long commercial about the effectiveness of what it is we do. And this morning I was able to actually get some numbers, which are really hard to get from our company, just being a publicly traded company. We pretty much protect a lot of our data until a quarterly meeting when we can release it. But things have changed so much that we did pre-release some information just so people are aware. And the reason I want to go over some of these numbers is just to kind of talk about the effectiveness of virtual healthcare and the adoption, which has happened greatly over the last 10 years, but really in the last month, we've seen an unbelievable adoption. So in the first quarter last year, or first quarter this year, I should say, so January, February, March, March being the COVID month, on there, we actually had 1.8 million people visit one of our doctors on a virtual basis on there. Currently today, we are taking about 20,000 doctor visits through our platform on a daily basis on there. And a lot of that jump was due to COVID, but a lot of that jump wasn't due to people having COVID, if that makes sense. And so 9 out of every 10 visits that we have taken so far year to date has nothing to do with COVID on there. These are people that have, whether it's a different acute episodic care condition, a cold, a cough, a flu, an upper respiratory bronchitis, a rash, a dermatology need, a behavioral health need, something of that nature is 90% of what we're treating on a virtual basis today. And the reason people are now more than ever taking that access is a lot of things. One is the awareness was made very public on that this is a product that is out there. But two, people are scared to go into a doctor's office or an urgent care center for fear that they may run into someone that is more sick than they are. And so they are counting on us to deliver that care for them, and we're doing that. We currently are averaging about a 15-minute callback time from the time of request, which means on average, if you request to have a doctor visit with a medical doctor, state licensed, all of our physicians are located here in the United States, we can actually make that happen in an average of 15 minutes. Those doctors can diagnose, treat, and prescribe medication if necessary over the telephone or video. So that lead in and what Neil was talking about, we've been doing this for a long time, and through many different surveys and talking to the tens of millions of members that we have, we found out that the need for more than general episodic care medicine was very prevalent. The employers were looking for solutions and employees were looking for solutions, and this was all previous to COVID. So what we did is we put together what I call a whole person virtual healthcare plan, and we called it Healthiest You Complete. We're going to go over that today and what that is and what that looks like. But as an employer, this is a benefit that you have available to purchase for your employees. We in the last 6 months that we have rolled this out, have seen a huge uptake in utilization on this, even prior to COVID. Obviously, COVID in the last month has driven it even higher, but the utilization on this particular product was extremely high. And because of that, when we rolled it out, because it was the first of its kind in the market on there, we priced it where we thought we might be on how much this would get used, and we were a little bit under. So on effective dates of July 1st and beyond, this product is going to go up in price. So when I get through talking today, if this is something that has interest of you in purchasing for your employees, working through your association here, I was able to hold that pricing again until a June 1st effective date to stay quite a bit cheaper than where it's going to go. So just kind of know that your association has done a good job on getting that price held. So what's it look like? What is it, and how does it benefit you? So as Neil said, this is available for all of your employees. We don't necessarily care if they're on your health plan or not. We don't care if you even have a health plan or not. We can bring this benefit to your employees on there for very, very inexpensive. If we cover your employees, we also cover their family without any extra charge. So no matter what's going on, if they have a family on their health plan coverage or don't have their family on their health plan coverage, it does not matter to us. Everything you see here is going to be available to the family. The access, the tools, and everything is kind of built in here for you, for your employees. The biggest challenge in telehealth, and we've had a great bump this last month, but is really just driving awareness and getting people to use it and know that it's safe and it's effective. And as Neil said, there's no cost for the employee to have any of this use on there. So they're able to have the access for them and their family to board certified physicians that are available to them 24 hours a day, 7 days a week, 365 days a year, and in all 50 states, meaning that if you have somebody go on vacation and they have a need for a physician, they can actually connect using this service, get the care that they need, and have no cost, no claim filed against your health plan.
The other thing I'd add to that too is that it eliminates people having to take off work if they got a sick child, or if they have to take off work to go to a doctor's office to get a prescription. So people can actually get prescriptions written over the system and not have to necessarily leave home or work. So it from a time standpoint, it's got some real good value as well.
Yeah, great point on theirs. We've made this available, like I said, at all hours of the day. And so, yeah, we presenteeism and absenteeism are two factors that weigh heavily, especially on smaller fully insured employers, meaning that we can keep people at work more, not even to leave for the acute care conditions. But even more importantly, the presenteeism, which is by definition the people that actually come to work, but they're sick. Those are the ones that are, don't want to spend $120 to go to the doctor on there, and so they try to tough it out, and they come to work and spread their illness, or they're constantly at work and on a computer trying to look up what might be wrong with them and things of that nature, so they're not being productive. And so, yeah, we do help a lot with that for sure. So go ahead and keep advancing those slides. Go ahead and pass through that. So inside of Healthiest You, one of the things that we did early on is we wanted to put more tools in there for the employees outside of the ability to connect to a doctor. And so built within here are pricing transparency tools. You can check the price of a procedure in your area to kind of see what that costs. You have intelligent alerts, which are the geofencing alerts, where if one of your employees goes to an urgent care and has forgotten that they have this benefit, as long as they've downloaded the app, they're going to get an alert if they've been in that urgent care parking lot for 2 minutes, reminding them that we can connect them to a doctor on there. So it's a great tool to remind people at the time of need when they have this particular service. They can locate doctors through this app on there. They can actually type in the name of the insurance carrier that they have and their group and member number, and we'll actually connect right into that carrier, and they'll be able to see like where they are in relation to their deductible and what their coverages are, and so forth. So it's a very, very robust product. You get, as an employer, you get a dedicated person from our office that helps you market this to your employees and helps engage and educate them. So that takes that off your plate. As business owners, it's very difficult to spend a lot of valuable time trying to educate people on a virtual healthcare benefit. And so we do that for you. We take that right out of your hands. So you get a dedicated client success team. There's a ton of marketing materials that are available to you: worksite posters, keychains, stickers for vehicles. Every employer is different, so we've got all kinds of different methods to ensure that your employees know that you have this on there. So at the end of last year, as I mentioned, with our surveys, we had a large meeting and really came up with the result of what employees are looking for is more than what is in your health plan. That's the general medical piece of that. And as Neil said, there's right now some of the carriers have dropped the cost to use that, but that will be short-lived. And there's usually almost every insurance carrier that I'm aware of has that service available, but it's really kind of buried in the back. It's not marketed. And then if somebody does find it, there is usually a $40 or $50 cost to use it. And so we wanted to put together something to alleviate that barrier from the employee, and that's what you're looking at here. We also wanted to create more of a whole person virtual healthcare product. And we were very successful in putting that together, and our data and numbers suggest that this is what employees want, because as I mentioned about our rate increase on this, is because the number of people using it has gone up immensely. One of the probably most important pieces that we have in this product today is behavioral health care. It is a proven fact in an economic downturn that the number of mental health cases increases significantly. And what does that mean? That means that comorbidities increase. That means that, unfortunately, suicides increase. People are just not well mentally, and it leads to a lot of other things on there. Maybe missed work time because of depression. Maybe, you know, I unfortunately just had an employer that had a suicide attempt with one of their employees. Now, this was a few months back, and so it wasn't because of what's going on now, but that employee not only was out of work for quite a while, but the health plan suffered greatly with that. And so mental health care is very important. It is something that I probably spend more time on this than anything else, because I believe that we have created something here that gives everyone access to what they need. The three reasons why people don't go and get care on mental health is number one is the stigma of it, is people feel like they will be looked at differently if they are needing or getting care on a mental health issue. The second reason people don't access this or get care is access. Maybe they don't have a provider close to them, or maybe the provider close to them is totally booked. I'm located in the state of Nebraska, and we have 93 counties in this state, and 80 of the 93 counties have no mental health providers. And so 13 of the 93 counties are all we have for providers in this state. And if you don't live in one of those 13 counties, guess what? You're going to have to travel in order to get care on there. If you do live in one of those counties, my guess is that it is going to take quite a while to get that care, and the hours may not favor you at work. And so we brought the access to the people. So this care would be administered on a virtual basis from home or wherever they're comfortable. It can be done by phone or video. And again, no cost to use this. Our providers that are facilitating this care range anywhere from medical doctors, so psychiatrists that can prescribe medicine if necessary, down to a psychologist, a master's level therapist that specializes in depression, anxiety, and things of that nature. And then our average time to get the initial appointment on this is 7 days or less. So versus a month for a brick and mortar visit right now as the average, we can get people care on a quicker basis, on a virtual basis. And then the third reason that people forgo care is the cost. And we've completely eliminated that as well with this product, is there is no cost to use it on there. So the behavioral health piece of this is huge on there. We've already seen a huge uptick in utilization on it, and I believe that'll continue to go up. We've put dermatology in here, which is the access to a board-certified dermatologist. Again, on a virtual basis, those dermatologists can treat conditions like rosacea, eczema, psoriasis, and other skin ailments. They can review maybe a patch on the skin or a growth or something that somebody has a worry about. Our board-certified dermatologists, through the camera on people's phones, that you can take a picture and upload that, can review those at no cost, and usually within 24 to 48 hours have a diagnosis and a treatment plan laid out, and if necessary, a prescription called in on there. So you're able to actually have that consultation with the specialist, again, without leaving work or home, and get that care at no cost. People that suffer from lower back pain, which is about 68% of everyone in the country, every adult surveyed, indicated that they have some kind of back pain, lower back pain. And so we've partnered with a company called Telus Spine, and we have actually brought in this product called Back Care, where the employees or their spouses or dependents, whoever needs that care, would be partnered with a professional that would design an at-home stretching and exercise program for them. They would give all the necessary resources to them, whether it's how-to videos or articles or different things of that nature. And then they're there as an accountability coach. If somebody has a question about something, if somebody's, maybe they've been prescribed an exercise and they have a video on how to do it, but they still don't understand it, they can get a hold of their coach and get a better explanation. Their back care coach will actually check in and keep them accountable and keep them on track on this program. And again, there's no cost to use it. Significantly cheaper than physical therapy. We tested this in one of our large Fortune 500 companies, and the results were pretty staggering on the amount of pain that was indicated, how much it has reduced or disappeared. But more importantly to that company is the number of back surgeries that hit their health plan dropped drastically. And then the adherence to this program is 85%, which means that 85% of everybody that starts this finishes it. And it's usually about a 6-week program. And so that is significantly higher than adherence to any physical therapy regimen. People usually will get started with physical therapy and then maybe find out they don't have very good coverage for that when they get their invoice, and then they quit going and so on and so forth. And then finally in here, we put
work comp, issue with back problems too. So there's just another little caveat to this.
Yeah, it's a very effective way. It's not, like I said, it's not us. It's a partnership we have with Telus Spine, and Telus Spine that's all they do. They just work. They're a group of exercise science and physical therapists, and they work, exclusively on back pain on there. So very, very, very effective. And then finally, what we put in here is to kind of round out everything is our expert medical services. This is going to really deal in the medical uncertainty part, the complex conditions, the high cost claims. This is going to give people access to the top specialists in the world. We've got about 55,000 specialists located all over the world. And these specialists go through a significant vetting on a rolling 2 years, meaning that every 2 years we revet them to ensure that they are still considered one of the top specialists in their field. They were done with a certification process by Gallup and certified to be the top 5% of the specialists in their field on there, and that's important. And we're not really tied to any institution, so they can be located wherever, and they will, they being the specialist, they'll review any significant diagnosis and make an opinion on that. And what that looks like is if you leverage this particular benefit, you're going to get paired. And when I say you, it's going to be the members. So it's whoever is on our eligibility census that needs the care is going to get paired with a state licensed physician in whatever state that they live in. And that's important because that gives that doctor the ability to really expand upon what they can do and what they can say on there. And that physician is going to be with that member from the very first phone call through resolution on there. And that might be in 15 minutes, that resolution may happen where somebody calls up and they just have a simple answer. Or that might be a 4 months of intense therapy or medical procedures to get through everything. But either which way, that particular physician is going to be available to that member for the duration. They're a resource for them. They also have the ability to do things like help the member find a specialist in their area. So maybe nobody has a diagnosis yet. Maybe they have an issue and they have a symptom, and they aren't sure even what type of doctor they should go see. They can actually use this benefit, get a hold of a state licensed doctor, have a consultation with them, and let that doctor say, here's the type of specialist I recommend you go see, and then let me look through our database and see who's in your area that takes your insurance, that is considered a top specialist. And they'll create those lists of doctors for them. So people don't need to go to social media and ask for a referral, for an example. We can do that all here medically based, directly from a physician, all the way up to if you have a current diagnosis and you want to have a second opinion on it. You've got lots of choices. You can go across town, you can have another claim, pay a bunch of more money, have more physicians review this, maybe more tests done, that kind of stuff. If it's something really significant, a lot of people will go up and schedule an appointment if their insurance allows it at the Mayo Clinic or a place like that, where they may spend 4 or 5 days away from work to get a second opinion. And we've brought all that to them on a virtual basis. And the state licensed physician is going to gather all the important medical information. We have a team of people that will pull all of the medical records for the employee or the member who has the issue. And so whether there's imaging or pathology or, different doctor visits, clinic visits, surgeries that were done, whatever that may be, we're going to gather all that on their behalf through HIPAA releases. They don't have to worry about trying to contact doctors' offices and getting all that. We get it all. If there's any imaging, any pathology, anything like that, we're going to reread all that with a specialist. So we're going to have a top radiologist review imaging. We're going to have a top pathologist retest and restain the specimen on a pathology slide. We're just going to double check everything. That's just the way it works. And then that state licensed physician will synthesize all that information, source out one of the top specialists in the world who will look at all the data and then make a determination on a diagnosis. If there's a change in diagnosis, which happens 45% of the time that we do this, they will back that all up with medical fact and the why there was a change in diagnosis. And then they will recommend treatment based on current science. About 80% of the time, that's going to be different than what the member was ultimately facing on there. And again, that's all going to be backed up by medical fact, clinical and human trial studies that are more current, and that kind of stuff. All of that information comes back to that intake doctor, again, who's state licensed, who then sets an appointment with the local in-network physician that the member was seeing, and they work kind of through that reporting from the expert and talk about it and try to collaborate on the best case of care for the member. We're going to give that local doctor an hour of continuing education to do that. And so it incentivizes them to get on the phone with us and continue to go through that. So that's all packaged into, that was kind of a lot, but I wanted to just really point out that that's really a robust product. And that's where virtual healthcare is going on there. About 80% of every reason somebody would need medical attention can be handled through this particular service. And as Neil pointed out, what that means is there's no claims file. This is all outside of insurance. It doesn't replace insurance by any means. Everybody should have some kind of health insurance coverage for the catastrophic things and the lacerations, the broken bones, the emergencies, and things of that nature. But this really can be a nice supplement to what they have to, on a virtual basis, really help people stay healthier, get to the physicians earlier. A lot of people will wait to go for care, mainly because of cost, or maybe they don't want to take time off of work or something of that nature. And we're able to get them that care like I said, as quickly as possible at no cost. So everything we talked about today, there's no employee cost.
And this is impact on really what it can do for the employer too. So, I mean,
yeah, oh, absolutely, yeah. I mean, it just there's just really a bunch of endless possibilities. But the reality is, this is the future of healthcare. I call it the front door to healthcare. This is where you'd want to start here, and if we can rectify your situation and get you better without ever going in to a physical visit, then there's obviously benefit to not only employee but employer on that, as we're giving that care on there on a continual basis at no cost, without people leaving and all that other stuff. Some of the perfect timing. I was just going to talk about this and leave that right there, Neil. Some of the impact on our general medicine visits, just so you're aware, 92% of every visit that we take on our general medical, the acute episodic care issues, are resolved with one visit. Meaning somebody doesn't feel well, they call up, they have a consultation with our physician, and our physicians are all medical doctors. That medical doctor recommends a treatment, whether it's an over-the-counter treatment or a prescription, and the member gets better 92% of the time without any follow-up concerns needed. And just so you're aware, an in-person visit, whether it's with your primary care doctor, an urgent care, or an emergency room, all three of those have lower numbers on follow-up visits than that. There's some factors for that. Let's be honest. Our doctors aren't treating as severe things that those doctors may be treating. So there might be a need for a follow-up visit. But in reality, if you go to the emergency room for a sinus infection, which, believe it or not, is not uncommon, the average cost of that to any health insurance plan, no matter how it's set up, is right around $1,700. And on the way out the door of an emergency room, you're given a discharge paper, and 100% of those discharge papers will let the patient know that they should follow up with their primary care doctor, and most of them do. So that's almost automatically a second visit where that sinus infection could have been treated on a virtual basis, for example. So, I could go on and on and on and on.
I would just chime in too that, emergency rooms are generally, if it's not a life or limb threatening situation, it's not admitted. And, the cost of that visit that gets billed out is, outrageous, because they're generally 4 times more than urgent care. And then you keep going downstream from that to try to encourage people to go to the, primary care. And that's where healthcare is really trying to drive the start of a claim, is to, see a general practice doctor. And we're taking it one step, below that and saying, hey, if you think you need to, here's a way you can do it for free, and that it won't have a back end charge to the health plan. And I think, again, we're going to see an effect of what this COVID's done to health plans that, have had to go through and endure all the different, changes with regards to the COVID. So it's all good stuff.
So if you have any questions on that, go ahead and send those into the chat on there. I think we want to move kind of through this particular product now, Neil, because I think we got 20 minutes left, and let's get down to the Clever.
Okay.
I don't see any questions or any chats yet so far, so I think we're good to go.
Perfect. Well, send them in anytime if you have them, and you can stop us. And if you, I think at the end, if this is the information that you want more detail on, go ahead and get a hold of Neil or Amanda. We can send this presentation out to you.
Pete, you had a good story with, I think, one of your members on that specialty healthcare with regards to their son who had a cancer diagnosis. And I don't, we don't have a whole lot of time, but I thought that was pretty powerful as well. How that turned out to, be a completely different diagnosis. And, while they were planning on going in with chemo and radiation, it turned around after they vetted the expert medical services.
Yeah, and just 1 minute overview on that. That's a coworker of mine, JP. He's in Denver, and his son was diagnosed last summer with he had a big bump on his arm, and they took him in, and the dermatologist, actually it was a cyst inside, and they removed it. And when they did the pathology on that, they indicated that it was a form of cancer in his arm. And basically, he got a phone call that said, your son has cancer in his arm, and we want to start a radiation and chemotherapy regimen right away to, basically kill all of the tumor area up in his arm. And JP leveraged this service. And anyway, long story short, the radiologist misread the pathology, or the pathologist misread the pathology slide. And we had a top pathologist at Dana-Farber Cancer Institute read that slide and basically got a hold of the pathologist in Denver and, went over the results on why he could totally see that he thought that was cancer, but it really wasn't. And the mutation of the gene wasn't quite what they thought it was, or stuff that's way over my head. But long story short, in the end, his son, the recommendation from the pathologist and one of the top oncologists, and also there was a dermatologist involved, was to just remove the all of the rest of the cyst out of the arm, and then go back in a few months to ensure that it's not growing again. And, fast forward to today, and there's been no regrowth of that. There was never a hospitalization. There was never a chemo or radiation treatment administered, which, health plan cost is one thing, but having your kid go through that unnecessarily is totally something else. So that's what that service is for. It is not uncommon for cancer diagnoses, for an example, to be altered.
Or misdiagnosed.
We reread. Say that again.
It was a misdiagnosis, and it,
misdiagnosis.
Something that was very traumatic for the kid and the family, and at the end of the day, it turned around, and it wasn't, there wasn't a lot of waste in it. Not to downplay that part of it, but just the whole story is pretty powerful to say, what one scenario can do for, a family and a health plan. So.
Yeah, absolutely. Yeah, misdiagnosis is the third leading cause of death in the United States, and 36% of every dollar spent in the healthcare industry is spent on an incorrect diagnosis. So it's prevalent, it's out there, and we're trying to do our part to just ensure that we get as many eyes on these complex cases or more severe cases that we can, just to ensure that experts all agree that on a diagnosis and a treatment path to try to alleviate some of that. So shifting gears,
I got a testimonial for you on this too, Pete. So
I'll let you just take it and I'll just fill in.
Well, I'll just start with, I wanted to check this CleverRF out against GoodRx, and we had a prescription that we didn't use anything on, and it was $60 through Costco, who's I'm a big fan of. The GoodRx came in with a $30 price point, which was great, and I was like, okay, well, let's see what Clever does. And yesterday I went to pick it up, and it was $13 and like 64 cents. And it was kind of made me scratch my head a little bit, but I wanted to share that with everybody. We got It's a very easy tool. It's free to everybody. They can use it and they can share it. And I just kind of wanted to roll out that to you, to everybody, but to you too, Pete, because it worked and it was
Well,
pretty
thank
simple.
you. Yeah. So let's talk a little bit about the background of CleverRF and why this was built. First, Neil said it, but I want to make sure that it's very clear. Completely separate product from what we just looked at on the Healthiest You on there. My background is I actually helped create Healthiest You way back in the day, but the founder of Healthiest You, the one that was the brains behind everything and got it going before it sold to Teladoc, is Jim Prendergast, and he created CleverRx as well. And really it was done with the same thing in mind, but what's really neat about it is this is a completely free benefit. So there's nothing to purchase. It is not a replacement for any type of insurance or anything else. It's just a tool that you can give to your employees, your friends, your families, your neighbors. It doesn't matter on there because it's completely free, and they can check the price of medications. And there's going to be a high number of times that we're going to be significantly cheaper than any other sources that are out there. And there's going to be times when we're not as cheap as everybody else. That's why I call it's a tool. Without getting into the convoluted back end of how the pharmacy world works, the price of drugs is under constant negotiation. And when I say constant, I mean daily. And so we have created a technology for members to go in and, we're going to offer this right through your association. So you're able to download it on a link, whether it's a website or a smartphone app. You'll be able to use our tool to shop the price of medications in your area. And we're going to shop it at every pharmacy located within a zip code and then give you what the price that we've negotiated is with that particular pharmacy. As Neil said, I don't know what the drug was, but if you got it for $13 at Costco, it may have been $45 at Walmart, for an example. The fact is there is a significant price difference in most medications across different pharmacies, and that's a constant change. So it's nothing static, nothing stays the same. The idea is to give people the tool to be able to search through and check. And one of the things that we found it very important to do, most people have heard of or seen a GoodRx commercial, and GoodRx has done a fabulous job of legitimizing the need for other sources on paying for prescriptions on there. But some of our advantages over GoodRx is we have gone out and cultivated direct relationships with some of the biggest pharmacies. And we've kind of cut out the middleman on this, meaning that on the back end, there's a lot of rebating going on and people making money every time a prescription is filled. Most health plans have prescription coverage built into them, and that's all handled through a pharmacy benefit manager. And that pharmacy benefit manager has cut deals with the health plan to give them rebates on prescriptions being filled on there, and then they kind of set their price and their coverages and stuff based on that. And so we've cut a lot of that out on how that works. And it's not 100%. I don't want it to misconstrue it. But a lot of the times we're going to be able to find a better price on most pharmaceuticals. These are going to be really in the what I call tier 1 or tier 2 drugs, something that has a generic attached to it, especially on those particular drugs that have a generic. Over 60% of the ones we have on our formulary are under $10. on there. The other thing that's different, and you can see this back, and Neil just had it on the screen, is because of that rebating, GoodRx or any other source may have a different price when the consumer goes to pick up that drug than what they thought they were going to pay. And that's because the dollars in that rebate have run out, and so they've had to raise the price on that drug. And so we've put a lot of thought and a lot of work into this. It's a win-win for everybody on there. Go ahead and go through that, Neil. Yeah, that's okay. We on there, but the reality is it's a simple URL where, and Neil can send this out to the association and they can forward it to their members on there, but they can, all you have to do is click on that link and you go right to a website on your desktop, or you'll go right to the app or Google Play Store on your phone and download the CleverRF app. It's open and ready to go for you. You type in the name of the drug, the strength of the drug and the quantity, and then the zip code, and you will see all of our pricing on there. And if it's better, if it saves you money on that, there's a easy button to push to get a voucher, and you hand that voucher to the pharmacist on there, or you can text that voucher if you're on a desktop. You can text that voucher to yourself, or you can print a hard copy of it. Take that into the pharmacist and give it to them. They'll key in that information, and it'll take the price of that drug down.
We'll send that out. I put that link on there. Sorry.
That's okay. That's something that you can maybe forward to the correct person, and they can forward it to all their members on there. But the key to this, and I stress this, it's completely free. There's no trick. There's no in-app purchases or something you have to buy later. None of that stuff is on there. It's a 100% free product. Why are we doing this for free? Well, because the amount of traffic that we drive into pharmacies, our contracts have a marketing agreement with those pharmacies where they will actually give us a few cents every time somebody fills a prescription using a Clever card, because they know that we had a hand in driving that consumer into their pharmacy, which their data will suggest that they are going to buy other items while they're in that pharmacy. And so everybody's like, well, how can you do this for free? What's in it? What's in it? That's the reality of it. Is CleverRx is not a nonprofit. It's a profitable company. GoodRx, for an example, it does a similar service. If you Google their valuation, they're worth about $3 billion today because they take rebating. They have a membership service you can subscribe to, and then they get the marketing contracts as well. So this isn't something that's a charity in there, but it is completely free. It is not mandatory that you use it. But I think you'll be very happy with the results if you do choose to, or your employees. And as I said, feel free, and our app and our website make it really easy. Share this with anybody that you want to on there, as we're doing everything we can to help drive down the cost of drugs in the United States. So that leaves about 6 minutes for any questions or anything you want to follow up with, Neil.
Hey, well, one thing I'd just like to add into that on my experience with the CleverRx is it wasn't one of your top 4 pharmacies. It was a Hy-Vee that popped up, and it beat Walgreens, CVS, and Walmart, surprisingly enough. So I thought that was kind of interesting as well.
Yeah, and that's why it's really important to use our technology, because obviously the CVS, the Walgreens, the Walmart, and the Kroger are the ones that we've got the best relationships with. And in most cases, they're going to be our cheapest price, but not all cases. And you never know unless you use the technology to figure that out. And that's what I love about this is the ability to, just shop and see. I've used it on some prescriptions that our family has picked up, and I've used my insurance on others. You just don't know. And I hand them both to the pharmacist 100% of the time. and say, tell me what's my best choice here. And they'll key them both in and they'll let you know. And, you know, it's just built to help try to save money on prescriptions. So.
Very good. Did any questions come up anywhere along this, or did we put everybody to sleep, or how did we do?
No, we're still here. I don't have any questions or anything so far, but if anyone has any questions, you can also reach out to support at u-r-g.com as well, and we can get you in touch with Neil and get you going with any kind of healthcare questions that you've got. I think I'll leave it open just for another minute or so and see if we get any questions, but I think you guys did a great job covering all of your points. I think you did great.
Thank you. Thank you again for taking the time to attend this webinar. And again, if there's anything we can help you with, you know, we're happy to do so. We got some more back-end information with regards to the COVID and, you know, the federal government, if anybody needs any support on that as well. I'm sure everybody's getting bombarded with it, but I don't know. We just kind of felt like this was a better topic than talking about the health plans, because it gets, you know, pretty complicated. This is something that can happen pretty quickly. So
definitely. No, I think the telehealth is definitely something to take advantage of during this time, especially.
And just to reiterate too, we've been able to hold that pricing for your association members until effective dates of June 1st. And that pricing, and I'm not sure that I covered that, on the Healthiest You Complete that we covered, is $14 a month per family. If your employer size or your employee base is less than 100 employees. It continues to go down. If you're bigger than that, on there, Neil can, you can work directly through Neil. We can get you a proposal on that. That's set to go up anywhere from $2 to $3 a month starting July 1st. So if that is something you're interested in, get a hold of us right away. We can make that happen for you at that lower pricing on there. And that sounds like the biggest sales thing ever. And it doesn't, I'm not intending for that to be that way. But the reality is the number of people that have bought this product and are using it exceeds what our projections were, and our projections were high. So we just have to charge more, because we're not charging any visit fees for this. So if you have interest in it, you're going to save yourself some money by enrolling between now and a June 1st effective date, and Neil can help you with that. So.
Awesome. Well, we don't have any other questions, so we'll go ahead and get wrapped up. And thank you guys so much again. And thank you guys for attending the webinar today, and we'll see you tomorrow. You guys have a great rest of your day.